Wherever I go, they are there. But I would like to be counted. Many of us are on different committees, have been on foreign affairs. I co-chair the Nigerian caucus, but I hope that we can find this extra padding of infrastructure of support here in the Congress as we raise up a very vital agenda that helps not only all of our friends in Africa, but really look to funding. Dr. Frieden cannot talk about what he needs. He's always smiling and saying he's making it. But I can tell you that we need to give him a boatload of money, because when we call, we expect, and individual members are calling. And I spoke to him, I don't know, doctor, was it late at night or early morning? But we were talking about what we needed. I remember distinctly. I needed a team at Bush Intercontinental Airport. But he needs a boatload of money. Let me finish on this note, because things are coming to mind, and I don't know if the ambassador from Nigeria is here. Is my good friend, okay, ambassadors. Let me see ambassadors so I can thank you for your service. Do we have any that are still remaining in the room? Any representatives from the embassies who are here willing to raise their hand? Okay. Let me thank all of you. And I ask that you count us as your friends. So as I step forward to make this comment, just as you reflect back on Ebola and you don't want to attack or accuse those who are being victimized, I want to make that very clear. Sometimes when in the midst of crisis, you're saying, why didn't they do that and why didn't they do this? That's why this meeting is very important. So let me say this from a perspective of non-attack. There needs to be a global and an African response to Boko Haram. Yeah. I said this before when I spoke to you. We were talking about bring the girls back. For those of us who know the story from this side, we know that those girls are probably married, impregnated, and their lives have been altered through no fault of their own. These innocents have been altered. I went, as many of you know, I said it before, to Northern State, Borno State, in the spring of 2014 to try and think that there could be reason and there could be apprehension and there could be solution. And as I have stood from this perch on Homeland Security, I understand that if you have a global effort to stop ISIS, ISIL, then you've got to have a global effort to stop Boko Haram. And they should not have a second-class status. And cannot look to one nation or to Niger or Cameroon or Chad to be able to singularly and solely address this question. So as I leave you, I am putting on extra armor. I almost wish that I could take a plane load, and I will not finish that sentence, so that there will be no tweets and others of a member causing havoc and leading warriors. I will not finish that sentence. But I do believe that the heinousness, whatever God we believe in, he has not countered and is not willing to tolerate this kind of violence and the absolute disrespect and disregard for human life, particularly precious 10-year-old children. If that shouldn't get you going, nothing can. So I hope that as you continue on this very important topic, dealing with the health infrastructure, we must realize that violence as well impacts on the health and societal health of nations, and I hope that we can join together on this infrastructure, health infrastructure issue, but I hope that you will find me and join with Congressman Bass on this issue of, if you will, putting Boko Haram to its rightly rest, if we could. God bless all of you, and God bless the United States of America and all of your countries as well.
Thank you. I'm going to let our last panelist take 1 minute. And then we'll do another round of questions. We may not be able to answer them all, but at least we'll get a lot of them out here before we close at 10.
Thank you. I wanted to address the question around Maryland County, which is in the southeast of Liberia, and that's a region that typically is forgotten when it comes to development, and even in the response, in the Ebola response, the southeast, I think there's been some huge gaps there. And from the very beginning, counties like Maryland and Riverside and even Bassa had very low number of cases. And I had been very critical of the way the response was being rolled out because I felt at the time that would have been the perfect opportunity to contain the spread when you didn't have hotspots and epicenters. So I just wanted to encourage counties like Maryland to just remain vigilant and put in place their own community contact tracers until more response can come in there.
Thank you. Thank you. Let's take 3 right over here, 3 here, 3 here, and then we'll start over again.
Good morning. My name is Michael Akpan. I am with the USSL Task Force for Ebola from Sierra Leone. First of all, I wish the Congressman had not gone, but I want to take this opportunity to thank the U.S. Congress, the government of the United States, for all what they've done for us. And I'd like all of us in here to give a round of applause for that extraordinary thing they've done. Now, I want us to be engaged. We've learned a lot of lessons. The experts up there were not experts before Ebola. Now they are. And we had wanted to be part of that expertise. We were shifted to the side. We were not engaged. I would like to ask, I know IMC is now engaging us, but what took them all so long? Our doctors and professionals have always been there to do what needs to be done. It's our war. We want to fight it too. So please engage us in this war. And lastly, the infrastructure. You can build all these infrastructures, but if you don't have permanent staff to maintain these infrastructures, it's just buildings, or maybe you call it relics. We need to have our people that are qualified go there and become part of the permanent staff. So please, so I'm hoping that this will address the issues that we have. Engage us. We have NGOs like all the other NGOs that are national NGOs in that country that will help make this difference. So please engage us. Thank you.
Thank you. I'm going to have to ask you to keep your questions or comments to 30 seconds. 30 seconds. That way everybody gets a chance. Thank you.
Good morning. Thank you, panelists and Congresswoman Bass. My name is Ero Summers. I'm an aspiring physician scientist with a focus in infectious disease. And my question is, what, at this stage, how can we apply the lessons that we've learned from the Ebola crisis to prevent and curtail future infectious disease crises? And especially me as an aspiring physician, are there programs? I don't have an MD yet, but I would like to get instruction and prepared it now, even before I complete my medical. Are there programs, and where are they? Where do I go? Thank you.
Good morning. My name is Maze Andrew Ndubisu Chomumu. I'm an attorney, and I practice here in Maryland. My question is purely legal. Is there anything on the ground that will help, say, an orphan in Liberia, in Sierra Leone, make sure they don't not only lose their parents, but lose their parents' assets, money in the bank, land, properties, contracts, rights of any kind? And what happens when these are neglected as we go on to combat diseases is that it will produce future poverty that will also lead to another outbreak of another high infectious diseases. So whether, my question then is there anything on the ground, are you thinking in that direction to fund attorneys that can make sure that the rights of the property rights of the people that survived Ebola are protected? Thank you.
Thank you. Thank you. Let's take 3 right here, 30 seconds each.
Good morning.
Good morning.
The name is Aissatou Sila. I speak on behalf of Ambassador Bokari Stevens from the Embassy of Sierra Leone. Our focus as an embassy is to recommend that emphasis should be laid on post-Ebola reconstruction in the health sector. As you all know, Sierra Leone has suffered greatly. Now it is dubbed the epicenter of the Ebola outbreak in West Africa. And so we as an embassy are recommending that a hub should be built in Sierra Leone to service all future epidemics in the sub-region. A hub, an international hub, with laboratories that can be able to do diagnostics for all epidemics, future epidemics in West Africa. And also, more infrastructure should be built in the health sector in Sierra Leone because we were ill-prepared. That's why we have noted the worst in the Ebola crisis. So we are pleading that more health infrastructure should be erected in our Sierra Leone, both in the provincial areas as well as in Freetown.
Thank you.
And also, emphasis should be laid on capacity building. We need to build the health sector capacity because we have over 10 doctors that have died. How are we going to replace those 10 doctors? These were the very best doctors that died. And so emphasis should be laid on how to develop the nurses, on how to build universities that will service future health carers, doctors.
Okay.
And also, I want strategies to be formulated that will look into the educational system in the event any future epidemic ensues.
Thank you.
That will take care of the students, not to be sitting in the house. Rather, alternative development strategies should be made now.
Thank you.
To prevent that in future. Thank you.
Yes.
Good morning. My name is Cynthia Bardwell, and I'm with Global Relief Partners. We're an NGO. We have a network on the ground in Sierra Leone. And my question is, I'll repeat it. My name is Cynthia Bardwell. I'm with Global Relief Partners. We're an NGO, and we have a network on the ground in Sierra Leone. We have not been successful in networking or engaging some of these international agencies and even here at home at the United States to plug in to offer some assistance to helping get us to zero. We want to do that. So if the panel can give us some direction and guidance as to how we may plug in, because we're very small, we're a new organization, but we do have some solutions, some ideas, and like to channel some of those to the appropriate parties. Thank you.
Thank you.
Good morning.
Good morning.
My name is Mohammed Jallo. I'd like to thank you representatives of the U.S. government for the tremendous amount of assistance that you've given to West Africa. About 4 or 5 months ago, one of those governments organized a dialogue in which I attempted to raise an issue, and at that point, the dialogue became a monologue. I'm hoping that that will not happen here in this case. One of the key reasons why Ebola spread in Sierra Leone is the lack of trust that the victims had in those who went there to provide relief to them. And I think since we're almost guaranteed that there will be another outbreak of Ebola, hopefully not on the massive scale that we've seen, we need to make sure we learn the proper lessons. And one of those lessons is that the people have to trust those who come to help them.
Got it. Thank you.
One of the reasons why they didn't trust them in Kenema is because there was a facility there from Tulane University, which was out there explicitly to test the presence or to detect the presence of hemorrhagic diseases.
Okay, I'm gonna have to stop you. Thank you. We hear you. Thank you. I'm gonna have to stop you. Yes, please, go ahead.
Good morning. My name is Naneba Jallo. I'm the president of Musolako Human Rights Organization in Sierra Leone and here in Canada. My question is, what are we putting in place for post-Ebola, especially for organizations like us who want to help out there, but we don't know who to contact here? Like my sister Kaba, Sarah Kaba said, the culture is very important. If you can't speak their language, they're not going to trust you. So we have people who do not speak French in Guinea, Sierra Leone, or Liberia, but they speak Madingo, they speak Fula, they speak languages that I speak, and they will listen to me. So what are you putting in place to coordinate with some of us here so that we can go there? I speak 7 languages in the 3 countries, and I can talk to anybody and they will trust what I tell them, even though I'm not the expert. I'm a dietitian, and I work at Howard University.
Thank you very much.
Good morning. My name is Georgette Spanjek. I'm with ML Strategies. It's great to see that these clinical trials are launching for vaccines and antivirals. However, the emerging debate in the medical community seems to be around the effectiveness of rehydration in treating patients infected with Ebola. This is an area where there's been a lot of innovation in the private sector here in the United States. For example, I represent 2 companies that are developing solutions that are targeting rehydration and treating the hypovolemic and hemorrhagic shock associated with Ebola virus, which most of the patients actually die from. However, what we're seeing is that a lot of the NGO and U.S. government focus has been on deployment and testing of vaccines and antivirals. Now that those trials are underway, and perhaps in light of the Cromnibus funding, can you address perhaps what USAID, HHS, and perhaps the NGO community are doing to help deploy and test these solutions in West Africa?
Thank you. This is actually our last question. I'm sorry, but we have to make this our last one, and then our panel can get a chance to.
Can I go ahead? Thank you very much. Good morning, everyone. I want to first and foremost thank Congresswoman Karen Bass and colleagues for organizing such forum. Second, I would like to thank the panelists for the insightful updates and regarding the disease outbreak in our country. My name is Besman Judo Junior. I'm a Liberian, and I'm a human service professional, and I have approximately 12 years of comprehensive experience in the field. Now, this is my question, first and foremost, to the panelists. How do we attract African-born Liberians, Sierra Leoneans, and Guineans with health and human services background in the diaspora to give back to our countries? B, this question goes to Serene. Serene, I have profiled you, and you are posted on social media once regarding an indigenous healthcare worker complaint about being underpaid. I would like to know what would be your recommendation, because I recall you posting a lady who once complained somewhere within the rural area in Liberia. So what do you think are some steps that could be taken to encourage these people that are providing such service delivery to our people?
Thank you very much.
And lastly, my last question goes to Congress, members of Congress. The Secretary of State, John Kerry, has repeatedly said that African governments are corrupt, and a lot of the funds and grants that are given for development lines the pockets of politicians. And we as Africans should take the responsibility to challenge them. With all these funds that are being dumped within our countries to support the Ebola containment, what are the steps that you guys are taking to provide transparency and make sure that the end users benefit from these grants and funds? Thank you very much.
Thank you. Let's start at the end. We're going to go in reverse order. Saran, please.
I'll be very quick regarding the question on compensation. In the beginning, there had been some issues around adequate compensation for healthcare workers and burial teams, which resulted in strikes and healthcare workers, threatening to not go to work. But I think the government has since dealt with that, and the pay has been increased, and it's now consistent. So I think that's no longer an issue. But certainly in the beginning, with all of the chaos, that was one of the issues. But we can talk more offline about that.
There's been quite a bit of questions about the engagement of the diaspora here, as well as NGOs that are working there. Engage us. Talk to us. We've been talking to the embassies. We've been working with the embassies, and we need some kind of a unified approach through the embassies, because there are a lot of groups out there. But I'm happy to meet after the meeting and talk about the NGOs that are working there, and if there's any way to engage, we're more than happy. And we're not the only ones. There are many NGOs out there. I would encourage you to reach out to them directly. Don't wait for them to reach out to you because they might not know you.
I'll be very brief, but if you've liked what I had to say, come to Center for Global Development in about half an hour, because I'm on a panel there. But that, not so much a plug as just explaining why I have to get out of here quickly. That will focus on post-Ebola recovery, so maybe I'll save any further remarks for that. But on the social protection question and the orphans question, I think that's going to be one of the big legacy challenges coming out of this, is a lot of those household level, community level impacts, people who lost family members, lost breadwinners, lost their livelihoods due to this, much more so than the macro level economic impacts. That's going to be a huge challenge, and one we're beginning to focus on and looking at payment schemes and a range of different options for trying to address that. There were several questions on diaspora engagement. The first point I want to make, and we are working to engage the diaspora, and our NGO partners are working to as well. But the powerful thing about the diaspora is you don't need to wait on us to get involved. You have your own links, you have your own connections, you have your own ability to mobilize. So don't be waiting on us or looking to us to somehow get you all into the game. Get yourselves into the game. You're in the game by virtue of your own connections. So we want to leverage that and work with that. But that's an incredibly powerful thing.
So I just want to emphasize the issue of building and rebuilding health and public health systems, rapid response capacities, laboratory networks at national level and in the subnational levels, primary care systems, which will have a big health impact. Malaria remains a horrible problem in each of the three countries. Someone asked the lessons for future crises, and I think it is that we need those robust national systems. Yes, we need an international ability to move in quickly and support, but fundamentally we need communities and countries to have effective staff in place, trained, resourced, and we're committed, working with USAID, with International Medical Corps, with community organizations and others, to building that. I do have one request for you in the diaspora, which is one of the challenges of working with the government is the issue of, are salaries paid? Is there transparency? Is there adequate administrative functioning of the public systems? We want to help build those, but we can't build them alone. They have to be built with pressure from within the country. They have to be built with commitment to accountability for outcomes. We will come with support, with technical assistance. We'll bring people in. We'll focus on coordination. But I think one of the additional things that the diaspora community can do is push for effective implementation of government programs. I think that the lesson for the future ultimately is that the future is now, and we need to move very quickly to get to zero, very quickly to stay at zero, and then to put in the systems that would prevent an Ebola or other outbreak in the future. So I want to thank the congressional leaders and staff who put this together, the other panelists, the members of the ambassador community, and all of the diaspora and audience for your interest in this issue. Ebola is somewhat off the headlines in the U.S., but it remains a terrible problem, as you know, in West Africa. And thank to all of you for what you're doing.
Let me get a final word here. I'm really impressed by the desire of all of the people who come from various NGOs to network and to be engaged. You know that there was a African Presidential Summit last year, but before it took place, there was an NGO summit to deal with some of the issues that were important, and Ebola was on that agenda. It might be interesting to see who those organizations were and try and connect to some of those organizations, because there are networks that are already in place. Thank you. This has been an impressive audience.
Thank you. Thank you very much. I just wanted to say really quickly in closing, my name is Travis Atkins, and I'm the staff director for the Africa Subcommittee in the Office of Congressmember Bass. She's had to take off, but wanted me to wish you all, or to thank you all for coming out. Our Africa Policy Breakfast Series doesn't work without your interest, your passion, your attendance, And if you guys could join us in giving one more round of applause to Dr. Gwendolyn Michael from Georgetown University, Dr. Tom Frieden from the Centers for Disease Control, Jeremy Kanindijk from USAID, Robbie Torbay of the International Medical Corps, and my sister, Saran Kaba-Jones from Face Africa. Thank you guys for coming. Thank you.